My name is Jill Bowen, CEO of Northwestern Medical Center and your host of the NMC Health Beat Show that is dedicated to discussing important healthcare topics for our community. Today I'm talking with Franklin Northwest Supervisory Union's Superintendent of Schools, Goodrich, and Judy Ashley, who is the District Director of the Vermont Department of Health in St. Albans. We'll be discussing an effort to gather key data on the health of our children in our community to inform our actions through Rise Vermont. So here we are, Judy, back again talking about Rise Vermont. So thank you both for being here. It's a pleasure to be talking about Rise Vermont and the impact on our children. So it's a great combination for Rise Vermont and our schools. So glad to have you
Happy to be here.
Yeah, it's great to be here.
So Judy, just in case our viewers are not aware of Rise Vermont, maybe you could ground us a little bit on what is Rise Vermont.
Well, that's hard to believe because I think everybody probably should know about Rise Vermont by now. I guess I'd like to ask a question first. What do you do to stay physically active, Jill?
What do I do?
Yeah.
Oh boy, I start my morning at 4:30 and I get up and I exercise. I'm either biking or running or some type of working out. And I've kind of got this interest in Kate Lattison's kickboxing. I've tried that out. That's kind of fun. So trying to do different things and playing golf. So try to be active.
Win, what do you do?
Well, I do it on the other end of the day. After long, tedious school board meetings, I go to Planet Fitness and I work out with the late shift crew. And I also enjoy biking and I love golf and I just can't wait to get back into it.
So, and I enjoy walking. I love to walk, and I like to get out as much as possible to walk. I love to snowshoe, but unfortunately the last few winters we haven't had a lot of snow.
Just go to Maine.
I heard. I
snowshoed. Snowshoeing in Maine is fantastic. Yeah.
Yeah, I've also gone to Duke's Fitness as well and do some working out there on the treadmill. So I think the thing about Rise Vermont is finding what you love to do, whether it's being physically active or trying some new and different foods. In Rise Vermont, we believe everyone should have a chance to be as healthy as possible. And we believe in people's power to change. And I think just listening to the both of you, you were very excited when you started talking about what you enjoy and what you do. And we want that to be for everyone, so people can make changes where they live, where they work, where they play. And we're there to support them. Rise Vermont is really a community-based effort, which is what is unique about it. It rises from the community. It's all about what's happening in the community so that we can live healthier lives by eating the right foods and staying active, and not smoking is another piece that we're really concerned about. So we have a broad array of strategies to try to get people engaged in being active and eating healthy. We have our famous smoothie bike, which hopefully a lot of people have seen out and about in different ways in the last year and a half. We support communities having bike racks and having bike racks near trails. We have an interactive map that's on our website, which is risevt.com. So you can go there and you can find about local trails and parks and other resources. One of the things we also did was make snowshoes available to libraries around our two counties, so people can go check out snowshoes when we get enough snow. So that's definitely a winter sport, but also people going out biking. We support that, getting biking trails. So we want to make everything available for families. We also have some health coaching and screening that we can offer. Signage for parks. We've done a lot of work with a lot of different communities, making sure we have signage on our parks so people know. And we are definitely a rock star on Facebook. We have lots and lots of people, almost 10,000 people that are following us on Facebook. And if you want to know what's going on, what the free events are, we post them there all the time. We have show-up events which are free for everybody, and you can try kickboxing, or you can try Zumba, or you can try whatever we might be offering. So it's really a way to get people to engage in their environment, find out what they like to do, and just stay healthy, and especially as families. So I think in keeping kids involved as well. Maybe even going out and playing hopscotch with your kid in the summertime. It doesn't have to be like people joining a gym or anything. You can just get out and walk. And I know for many people that's a challenge sometimes to just get outside and start walking. But if you start, you can continue and keep going and keep going. So I think we're all about encouragement Rise Vermont and positive reinforcement, and that comes through in everything that we do. So,
Terrific.
yeah.
And when you think about Rise Vermont, you know, why is Rise Vermont working with schools and our children, and what are some of the things that are happening there?
Well, it's an old saying that children are our future, and we all know that's really true. And we want to make sure that all of our children can grow and learn, and that they feel good about themselves too. I think that's an important piece. Most of all, we don't want to see them develop chronic illness, and that can be prevented. Many of the chronic illnesses can be prevented. And schools play a critical role in promoting the health of young people and helping them to establish lifelong healthy behaviors. So that's important that we're working with that population, including, I might add, you know, the kids are really young and, you know, not in school yet, and helping families across the board, you know, the 0 to 5 population. So using the Rise Vermont school and classroom scorecards, we have scorecards which are on our website, risevt.com, that support teachers and staff by creating healthy and active environments in the classroom, working on proper nutrition and physical activity. We also work with the local public works people and planners around, and the police departments to make sure that kids have safe routes to walk to school. They look at, and biking to school, if kids can bike to school, depending where they live. We work with teachers on short-term physical activity breaks throughout the day, so maybe a yoga or a stretch break or a dance break in the classroom. That's part of what we try to get people to do. We know that if kids get up and move, they're more likely to learn better and be able to have better behavior. We've done activities like working with young people around how much sugar is in the drinks that they have, and that's a very popular thing to do. And kids actually can pour out the amount of sugar that may be in a soda or a Gatorade or something that they're drinking, and see exactly how much sugar is there. That's huge, and it's a small thing to do, and they become champions in their house and in their friends. And it's amazing when kids get hold of something, they don't let it go. And then they keep reminding their parents, you know how much sugar is in there? Schools are encouraged to have wellness committees as well, and we work with their wellness committees to look at changes that can be done in the school to support healthy behaviors. For instance, last year, the Alberg Community Education Center added a salad bar to their lunch, which was coming out of working there with their wellness committee. We're seeing more and more schools and businesses actually that are interested in gardening and doing some gardening, so gardening is coming back. And I think maybe eventually canning might be coming back too, because I've seen some things on canning, so that's really good. The Alberg Elementary students as well, they did a gleaning program last year over in the islands, and they went out and collected apples out in the field and from the orchard, and they saved that produce from going to waste, and they were able to give it food shelves around the county. So there's a lot of things working with kids, and kids are just fun. You know, they get excited easily, and they really like enjoying those kinds of things. So it's really fun to work with that group of folks. Yeah, the little kids.
Yeah.
Big kids too.
Great, thank you so much for that overview. That was really great. It's fun to hear all the things that are happening in the schools. So, Wynn, what prompted you to want Rise Vermont in the school systems? Let's hear from the schools.
Right,
Well, now you've got to have them in there, right? After you just heard all that.
well, and we do, and we've been working in that in that direction for many years. So it's very nice that Rise Vermont has come along and helped us to really ramp up beginning stages of wellness. The piece, though, that I'll sort of chide Judy a little bit, on the Facebook website, if you would have people walk to town meeting next Tuesday, if this is going to be aired before March 7th, and have them engage in competitive school vote support, that would be wonderful.
Oh, that would be wonderful.
New activity.
Yeah. We have to put that on the list.
Yeah, that would be good. So with that in mind, schools have been working on wellness for a while, and I'm very pleased that Rise Vermont is making a connection with the Vermont School Board's Insurance Trust, which has done wellness for educators for a long time, with the intent that educators and staff members model healthy activities and healthy behaviors for children. If children see adults exercising and see them eating well, then that sometimes is a better message than the adults telling them what they should be doing.
Right, right.
And one of the things that comes to mind as I heard Judy go through that litany of wonderful activities is that, for example, in Swanton on Wednesdays, through most of the year, we have a walking school bus that children walk from all corners of the community, and we even have a partnership with a bus company that picks children up outside the 1 mile radius. We'll drop them off at the
Nice.
five centers so that they can walk in with staff members, and that's a great way, 1 day a week, with the exception if it's 30 below zero, we don't do that. But children and their parents and staff members with the green fluorescent vest do that activity. The other thing that I think a lot about, what Rise Vermont is helping us do is shine a bright star on the important components of wellness. And we're required by federal law to have nutrition guidelines for cafeteria.
Yes.
In fact, I'm very pleased to announce that on March 20th, we're going to have a press conference at the Missisquoi Valley Union, and right now, with fingers crossed, we're going to have a New England Patriot football player there to promote the Fuel Up Play 60 Minutes, the NFL initiative that encourages children to get out and play 60 minutes a day. And
Great.
the Fuel Up component is part of the New England Food and Dairy Council focus on nutrition and eating.
awesome.
So
Wow.
I said we could
Yeah,
have
very cool.
Brady would be fine and Gronkowski would be good, but Malcolm Mitchell, if we can't have the two premiers, Malcolm Mitchell has a wonderful message about connecting reading and athletics, and he's a very gifted athlete, but he couldn't read, and so he started to go to
Wow.
women's book clubs, and he recognized that that's an area that he needed to develop. So I think that would be a powerful message for children to say,
Yeah.
education is important, and so are athletics.
That's right.
So that's a piece of we're thinking a lot about.
Great.
It's terrific.
And MVU is the fastest growing high school in the state of Vermont as far as their meal program. We feed 840 students in 40 classrooms every day, free breakfast delivered to the classroom, and it's made a tremendous difference in the behaviors and the activities in school. The behavior incidences have been cut in half, and a lot
Wow.
of kind of the early read is maybe children are hungry.
Yeah.
And more than 50% of our children come from poverty backgrounds where they likely don't have a lot of food or maybe any food. And so children coming to school that don't have those nutrition opportunities have a difficult time learning.
Wow.
So we're very pleased about that, and that's why the press conference is happening. So
Nice.
keep fingers crossed.
Good for you. That's exciting.
We'll go from there.
That's exciting.
So the diet is a key part. This also, the surveillance work that we're doing with BMI connects very well with a tobacco grant that we have for the next 4 years that requires, through Center for Disease Control, that we do a school health index, and in that is the requirement of BMI. So anytime, I remember back when I was in high school, that anytime that I could do a paper for science teacher and maybe for history teacher, the twofers were really the way to go. Well, this is a twofer.
Wow.
Because we're doing BMI for this grant and the BMI for schools and children throughout the Grand Island, Franklin County. So we're excited about this.
So do you mind if I kind of clarify what BMI is?
It would be great to actually talk about that, because we want to certainly allow our viewers to
Yeah.
understand,
Yeah.
how are we making a difference, and what does BMI mean, and what do we hope to accomplish? So if we could talk about that.
I'll just,
Why don't
I'll
you,
just
run with that?
okay, thank you, Wynn.
Yeah.
I'll just, so BMI is really its body mass index, and it looks at your height and your weight to work out if your weight is healthy. That's simple. Your height and your weight will tell you whether your weight is healthy for you. Okay. The reason we feel like we're going to see positive results with Rise Vermont is because it's community-based, like I said. A lot of initiatives come down from top down and don't really hit the average person in the community. And we're only going to know success if we check our progress from time to time, and that's what we're trying to do now. We're already seeing positive results in many communities. We know the Safe Routes to School program when we started Rise Vermont, it was 4 schools, and now we have 12. We have 46 businesses that are involved with Rise Vermont and 10 municipalities that have been working with us. And we see more and more people attending our Rise Show Up events, so it's become very popular. We had them just in the summer before, and now this year we've done some during the winter time, and they have been extremely popular. Like I said, people can try out new things, Zumba or whatever. So those have been very popular. So those are kind of short-term results, but we're really, we want to look at the long-term results 4 to 5 years from now. And we expect to see overall change in the health of people in our 2 counties around decreasing overweight and obesity. We also want to see, people eating more fruits and more vegetables, increase access to smoke-free areas for people. And that's all information that's already tracked by the health department through different surveys that are done, some in the schools and some just for the general population. So that data we can get, some of it yearly, some of it every other year. But another way that we can make a difference is by looking at the kids in the school. And one way to do this is the body mass index, to see if we're really making a difference in our programming and things that are happening. But we know that BMI is accepted around the world, and that's one of the reasons we want to use it. And it is the best way to find out if we're making a difference. So Wynn's going to talk a little bit more, I think, about working with the schools and the approach. So.
Yeah.
Well, before I kind of move into that, one of the things that I've been tracking for a long time is a wonderful graph in Center for Disease Control website that talks about the migration of kind of child well-being. It talks about adult well-being, but I've always mirrored it with the children are following directly behind that. And 1 in 3 children in the United States are overweight right now, and that's a concern. And the concern is that it's going to lead to immediate health challenges as well as long-term health challenges. It's been said that we're raising the most unhealthy cohort of children in the United States in the history of this country, and that bothers me.
Sure, absolutely.
And so this is all part of, we can set back and we can admire the problem, or we can jump into it and begin to make a change. And what we're doing in this project is moving forward in June, and we're still working out some details for how this might happen, but the intent is to bring together children, a couple thousand children, grades 1 through 6, from Grand Island, Franklin County, and to bring them together in a wellness health fair, likely at Collins Pearly, but we don't have confirmation of that yet, so we'll just leave that open-ended. But the power of bringing educators and children and the medical profession and the health department together and do a fun kind of 4-station wellness activity where one of them would be the body mass index, and we'll keep it so anonymous that we're actually going to do it heights in centimeters and weights in kilograms, that we're not even going to know what those measurements are. And again, it's the broad surveillance that's the important factor here. It's not any individual child. We're going to follow the migration and health patterns of 2,000 children over a multi-year analysis, and that's
so no individual names are happening. It's all an aggregate.
It's all anonymous.
Yeah, thank you.
So with that, some nutrition activities, some mindfulness activities, so that they learn some relaxation. They have some fun physical outlets. We'll do the BMI, and I think there's a 4th station that we haven't exactly figured out yet. But the buses will come in, and we're talking about 40 buses. We're talking a lot of children. And in June, that's a difficult time to kind of keep kids focused on the mission of school. So it's a great time to be able to begin this process. We may do all students in grades 1 through 6, or we may alternate grade years, depending on how we can get this organized. But that's at least the plan for now.
That's terrific, and thank you so much for your engagement with Rise Vermont and this really key component of this data collection. So it's going to tell us a lot, and I think it's going to be fun for the children to participate in this wellness event. And again, it's not about stigmatizing any individual about their body. It's really about an aggregate data collection and overall wellness, and doing some of the neat activities that you talked about. That salad bar was a terrific example, and how do we actually bring wellness into the classroom. So that's really cool work that's going on. So as we wrap up our time here, what are the next steps? Anything that you want to let our community, our viewers know about this and what's to come as we wrap up?
Well, I would say that the part that's really exciting for, I think, all of us is this isn't just isolated in Vermont or in Franklin and Grand Isle County. We are building on the research that has started in the early 90s in France and in Belgium, in the Netherlands, and building on that research. And that's really where the power of this becomes international.
Yes.
And we're utilizing the expertise of people that have been before us. And rather than recreating the wheel starting from scratch, we're building on that data and connecting with children and schools and communities throughout the world.
It's fantastic.
Yeah, it's very exciting. I agree with Wynn. The opportunity to do this project here, to be a leader in the state of Vermont, Franklin and Grand Isle County as a leader in this effort, and we can all make a difference, and we really are encouraged by the first couple of years of Rise Vermont and the success we've had, and we want to continue that. And the way to really see if we, besides all the other things I talked about, making a difference, is really looking at the children. And again, nobody will be stigmatized. It's all anonymous, so parents don't have to worry. You know, and it's going to be a fun day, and it'll be just part of the day. So the kids will be fine.
That's
Okay.
terrific.
Yeah.
Maybe we'll put parents to work if they come in June to this
Yeah,
event.
we could
may need
use
them.
volunteers.
Volunteers, that's
Yes,
right, that's
Rise Vermont
right.
volunteers,
That's right.
definitely.
So Jerry and Kate, you're signed up.
So thank you both very much for coming on the show and talking about Rise Vermont and the importance of engaging our children. They are our future.
They are.
So getting this data is really important to our wellness and have healthy children, healthy families, healthy workforce. It's a healthy community.
Yes.
So it's really powerful. So I'm Jill Bowen. I am your host for the NMC Health Beat Show. And I encourage you to go on www.risevermont.com to explore this a little bit further and how Rise Vermont is embracing healthy lifestyles, a community-based approach. And we want you all to be a part of it. Thank you for joining us today.